As usual, there are a lot of things to talk about when it comes to COVID and vaccines and booster shots.
And as we do every Tuesday, we have UW Health's Chief Quality Officer, Dr. Jeff Pothof, here to sort it all out
Everything.
for us once
Sort everything
again.
out.
There we go.
All right, well, welcome back.
Thank
you. Cases are down.
Yeah, I mean,
right?
This is good news. We haven't said this in a while, but it looks like our cases here in Wisconsin are on a bit of a downward slope. So fingers crossed, but it'd be nice to see that continue.
What do we attribute that to?
You know, I think part of it is Delta's done what Delta's going to do. Hopefully, we don't see any surges of that. And I think part of it is, you know, as Delta got worse, we started to see vaccination rates creep up a little bit, and that helps too.
Why wasn't there a booster for Delta?
Yeah, I think someday there will be boosters for these variants, but I think these variants can come on so quickly that by the time a manufacturer could alter the recipe and then create it and then distribute it around the country, it just takes longer than what these variants are giving us time to do.
Let's talk about the boosters. Moderna and J&J probably be approved sometime later this week for a booster.
I think so. So you have the Pfizer approved. I think Moderna's going to be approved, and that one might be a little bit easier. It'll probably be the same group of people that Pfizer's approved for. So 65 or older, those with you know, medical conditions that put them at risk, or employment that puts them at risk. Johnson & Johnson, I think, will be approved, and that'll be for anyone who had that vaccine, as long as it's a number of months after that original dose.
Can you switch?
Well, you know, I used to say they didn't recommend that, but there's some studies out there now showing that, particularly if you had Johnson & Johnson and then you get a booster with an mRNA vaccine, so Moderna or Pfizer, that might be better than just getting a Johnson & Johnson booster. The UK has looked at that with AstraZeneca, which is similar to Johnson & Johnson. If you boost that with an mRNA vaccine, it might be better. So, you know, keep your eyes peeled, but I think there may be, you know, a recommendation that you can mix and match some of these things. Certainly it would be okay to get the same one that you already got. But it might loosen up a little bit around that.
So what do you say to, I mean, there are still naysayers out there, we know this very well, regarding the vaccine, and earlier it was reported that no, don't mix, and now months later saying, oh, okay, it might be okay to mix. So I'm thinking that those who are against this are saying, see, they don't know what they're talking about. It's like coffee. You can have coffee one day, it's great.
Red wine's good, red wine's bad.
No, we've been dealing with this.
Explain this?
We've been dealing with this throughout the pandemic. We explain it because science happens, and science is doing research studies, experiments, looking at the data and saying, is what we think is true, is that still true? Are we learning more? And it happened with masks, and now it's happening with some of these hybrid vaccines where there's data that would suggest that maybe you can mix and match and it doesn't cause any safety problems. Immune responses are good, and it makes it a little bit easier for folks because they're not trying to match up their vaccine with what they got initially. All of this said with a caveat is we have to see what comes out of the FDA and the CDC over the next 7 or 10 days.
But you hear the complaint, it's too quick, it's too early, that they don't know enough about it yet, the vaccines.
Yeah, I think you hear that because oftentimes when you hear doctors talk or you hear health officials talk, it's based on decades of data. You know, people know, you know, what risk factors heart disease has. They know what happens if you have diabetes for a long time. With COVID, it's all happening pretty quickly, and the data's coming in. There still is a robust process to make sure that the data that we have, that it is peer-reviewed, that it's statistically significant before these decisions are made. So it's happening quickly because we need it to happen quickly, but we're not cutting corners when we do it.
So Halloween is coming up really soon, and last year it was, people got creative to get those treats down, like PVC pipes and stuff, right from
those
their
delivery
second floor.
systems.
Yeah. What are your thoughts about trick-or-treating for the kids this year?
Yeah, I think, you know, with cases where they're at right now, what we understand about COVID-19, if you have kids who want to go trick-or-treating and they're a relatively small group, you know, a handful or so, they're outside and they want to run to a door, get a treat, and run back out, that's probably okay. You know, there's a lot of masked heroes out there, so that might be a costume that you might want to prefer this year, but I think if we do that, that's okay. If we have Halloween parties where we gather inside large crowds, including folks who are unvaccinated, vaccinated, that's probably a little bit dicey yet.
Should you wipe off the food, the treats when you get them, wipe them down?
I don't think you have to worry about that, you know, as much. You know, clearly there's some safety in saying just let that candy sit for a day in case, you know, someone does have it, but, you know, our understanding of COVID-19 transmission on surfaces has advanced a lot, and it's not as risky as we initially thought when we were doing displays of like washing off your groceries and things like that, you know, a year and a half ago.
Goes the masked man for
Yes.
Halloween.
Well, let's hope we have even better news next week when we see you.
Doctor, good to see you again.